Good evening, and welcome to Hope for Healing. I'm your host, Dr. John Stracks, joining you from my office here in Chicago. I'm a physician who focuses on the reduction and the elimination of physical symptoms using mind-body medicine methods. If you'd like to learn more about my practice, I do practice telehealth, and my staff will be happy to talk with you. You can find more information about all our services at www.drstracks.com. This Hope for Healing videocast series is one of many joint efforts between me and the folks at Curable. For those of you who are not yet Curable users, Curable is an amazing app that offers science-backed techniques for chronic pain recovery. We've been working together for about 6 years now, and we created this video series together because we want to help people in pain understand the connection between what's happening in their lives, what's happening in their bodies. Today, my guest is Nicole Sachs, who many of you already know. For those of you who don't, Nicole is a psychotherapist who's dedicated her practice to the treatment and healing of chronic pain and related conditions. She's an inspiring speaker and the author of The Meaning of Truth. Nicole's passion, or one of her passions, is journal writing as a means of healing, and so that's going to be the focus of our conversation today. There's a lot of talk about in mind-body circles about using writing and journaling as a path for healing, and a lot of questions about how that works. And so we will go ahead and dig right in. Nicole, it is delightful to be here with you and great to see you.
Awesome to be here.
Thanks for joining me. And anytime I get to spend 45 minutes with you is a good day in my book.
Awesome.
I was just thinking the other day about how you and I first met. I think it was about 10 years ago. And did Eric Sherman introduce us? Is that how you got my name?
I don't remember. So much magical stuff has happened over the past 10 years, especially in relation to this work. So I don't remember exactly how, but I do know it's been a bit since we connected. Yeah.
Yeah, no, I remember I was in Colorado for a series of workshops on psychotherapy, and you and I had been connected and trying to talk. I called you from a coffee shop in Broomfield, Colorado. That's my memory of connecting for the first time. And you're right, so much has happened since then. We put on a conference together. We've grown our practices in this area. And so before we get into the talk about the journal writing, which I know people are interested in hearing about, I do want to talk about kind of what you and I have learned over this decade as we've put together each of our practices in this field. And people have heard our stories, your story about healing, my story about healing. And so I'm not going to delve super far into that today, but I thought it'd be interesting for people to hear a little bit about how we got involved in this professionally. And you got better and you had talked to Dr. Sarno and healed your back pain. Were you a psychotherapist at that point, or did that come out of that work that you did?
So I had gone to undergraduate and had my bachelor's in psychology. And then while I was in graduate school, getting my master's in social work, that was when I was first exposed to Dr. Sarno's work via a book. So I didn't know anything about him personally. I had never met him, but through reading the book and understanding his work, I eliminated my back pain completely. So originally at the very beginning of my recovery story, which recovery is not a straight line and everyone always has to remember that, I was what they call a book cure. I understood it by just simply believing that nothing was physically wrong with me, calming my nervous system with that really staunch belief through really connecting with his words and with his description of TMS. I was able to eliminate my pain. And that was in grad school. So by the time I had my dip, what they might call a relapse or a whatever, the valley in the hills of valleys of recovery, I was already a trained therapist, but and I'd already gotten all my credentials and I'd already passed all my boards, but because I had 3 kids within the span of 5 years, I was not actually a working therapist. So when I met Dr. Sarno in the midst of an incredibly terrifying chronic pain, acute pain incident, I was inspired to I was ready to go back to work, to go and establish a practice. And then through my work with him at NYU, because I was speaking on his alumni panel every month, he said to me, where are you establishing this practice? And at the time, he was in New York City and I was in Westchester County, New York, which was good because it was about a half-hour drive outside of the city, and it availed people in the suburbs of a trained Sarno therapist. So he started referring into my practice, and that's how I started.
Yeah, which is amazing. And, and these days, a lot of people don't know who Dr. Sarno is, remarkably. When you and I first started, for those of you who don't know, he's a physician in New York City, passed away a number of years ago, but was really the first person to popularize this idea that we could heal what's going on in our body by paying attention to what's going on in our lives. And so I had studied with him a little bit. Nicole, you had been treated by him at one point, and you and I actually were in the same room when you spoke on a panel discussion, probably in 2007, maybe, when I went out to study with him. And so much has happened in the field that a lot of people don't know who Dr. Sarno is anymore, but one of your and my original mentors in doing this work. And I, as you know, had some pain experiences before I even went to medical school. And so this was the type of practice I wanted to have all the way through. And medical school almost like beat it out of me. And so by the time I finished my clinical rotations, I was like, oh, I'm just going to be a cardiologist like everybody else is a cardiologist, and then sort of found renewed interest in it. And so did you ever then practice psychotherapy in a more general sense, people coming in for anxiety, depression, and non-pain related conditions?
Yes, actually. So when I first did establish my practice, I mean, Dr. Sarno was referring to me, but that was maybe one or two patients, they were kind of coming in slowly. And so I had a general practice, and actually my general practice was an excellent a way to be informed about what's really important in this chronic pain and conditions work, because in the end, it's all just about what's going on for us, how we are metabolizing our past trauma, what we're avoiding, what is stored, the whole body keeps the score thing. And so in my general practice, I was just open to just being with people. The mantra of social work is you start where the client is at. And so just being with people right where they were was a really excellent preparation for becoming completely specialized in the later years of my practice.
And then did you have patients who you converted from sort of general therapy clients into working on chronic pain issues? Did you find that sort of over time, as you got to know people were more open to the idea that they could heal their physical symptoms using psychotherapeutic techniques?
Absolutely. And I think one of my favorite things to watch in people is the light go on in their eyes when they realize that their body can be their proof. So let's say somebody comes in presenting with relationship issues in their marriage, or difficulty with their kids or whatever. So it's just a typical psychotherapeutic presentation. And then through the by and by, we discuss, and they're like, yeah, well, one of the biggest problems is I always have these headaches. And so it's very distracting for me because I'm trying to parent and my kids are this and this. And, sometimes I have to go lay down. So I might say, might I gently suggest that there could be a mind-body component with your headaches, that it could be the fact that you're so frustrated and angry. And this is sort of like an endless negative cycle. And so they would say, well, I don't know, but then they already trusted me. So I would say, let's try these methods and let's see. And then their body becomes their proof, because they come back to me and they go, it's the darndest thing. I love when people say, you're never going to believe this. It's the darndest thing. I tried that mind body work you're suggesting. I haven't had a headache all week. And I say, yes, I know, because this is how it works. And then people become real believers.
Yeah. And thinking about how our practices evolve over time, starting with yours, how did you explain mind-body concepts to people when you first started? And then what did you learn as you were practicing that sharpened your ability to help people relieve their symptoms?
Well, one of the first things I tell people, and I still say this, is what I'm teaching you is something you already believe. You just don't know it yet. And then I'll say, I could be lecturing to a room of 1,000 people. And if I say, raise your hand if you've ever had a stressful day and gotten a headache, every hand in the room goes up. And I say, okay, everybody put down your hands. Raise your hand if the next morning you ran out for a CT scan of your brain because you're sure you have a brain tumor. And all the hands go down. I said, because you believe that a stressful day can cause a headache. And then we do the same exercise with raise your hand if you've ever heard of somebody who was in a panic and got hives. Raise your hand if you ever heard somebody who was terrified, who got diarrhea or went to throw up. And so it's almost like helping people understand that they already are full believers in what I'm about to teach. But when pain becomes chronic and fear becomes the primary motivator, all of that belief goes out the window, and they're obsessed with treatments and specialists and injections and surgeries and what have you. So that is the first way I explain it to people, that this is not such a bridge that they need to cross as much as they think. And of course, the biggest example ever is, what happens to you when you get really, really sad, touched, or moved? Water falls out of your face. The most basic emotional stimuli leading to a physical reaction. So I get people in my camp. I kind of draw them in because I just want to do it with love, because I have such tremendous compassion for people suffering, because they don't want to push away solutions. They're just terrified. They're terrified, and they have only one way they've ever been taught, which is in the basic traditional Western medical model, which is if something's wrong with your body, you need to alter your body. And I understand that. And I have great empathy for that, because that's how I was until I wasn't. So that's my entry point. And then in terms of how it's evolved as I've moved through the years, I guess the most obvious evolution is that I don't practice privately anymore, because it became apparent to me in and excuse the term, miraculous recoveries I was watching hour to hour in my practice, that I needed to take this information and use all of my energy and my time to bring it out on a much wider scale. And that's when I wrote the book, and I wrote the courses, and I started all my online offerings and my social media presence, because I just want everyone in the world. So I have bold aspirations. I want everyone in the world to at least know that this work is an option. Certainly, I am under no delusion that everyone in the world is going to pick up what I'm putting down. But I have so many people who write to me and say, I found your work. I'm totally healed. I'm back to work. I'm having a baby. I'm getting married. And I can't believe for so many years I had no idea that this existed. And so that's my primary purpose at this point, to give as many people an idea that this exists, and then they do what they will with it.
Yeah. And thinking about what we were talking about earlier, 10 years ago when you and I first talked about this, Dr. Sarno sold a couple 100,000 books, not really more than that. And so there was probably, still in the hundreds of thousands of people who knew about this concept. But at this point, Curable's been downloaded millions of times, and there are hundreds of therapists that we're connected to, and physicians by an email list that's gone on over the course of a decade. And so there are literally millions and millions and millions of people around the world who understand these ideas, who have been introduced to them, and who are still, yeah, isn't it amazing?
Yeah. It is truly amazing. Yeah.
Yeah. And so how about your own experience? And so you've spoken extensively about your experience with pain and what happened. How has that informed the treatments that you've done with people, both on an individual side and now on a broader level as you're working with populations as opposed to people one-on-one?
I have a series on Instagram called, it's on IGTV, and it's called I Am Evidence. And the reason that I named it that is because my greatest teaching tool is myself. Because I know my story, obviously, more intimately than I could ever know anyone else's story. And so weekly, when I post these videos, I use whatever's going on with me as a teaching tool. And so really, that's just been my method from the start. So in terms of the journal writing, the reason I use my story is because my story is the way this journal writing changed my life profoundly in terms of elimination of pain, and the secondary change, which is everything about the way I operate. Because when I stopped filtering all of my life decisions and my parenting and my self-esteem and my self-worth through the lens of my repressed emotions that I did not realize I was repressing, it's just opened me to be a person of incredible confidence and esteem and compassion. It's just incredible. So a really brief overview of my story is, as I mentioned previously, I did have this pain relapse. So the book cure took me for so many years. And I was actually told when I was originally diagnosed that I would never have biological children because I have an abnormality in my spine called degenerative spondylolisthesis that is seen on MRI. And I don't know, John, you've probably never seen my MRI. But
I have not seen your MRI, correct.
But according to the orthopedic surgeons I've spoken to, my MRI makes them like feel a little queasy, like it's bad. Okay.
Yeah.
On paper and film, I'm quite a serious case. And so I was told by well-meaning doctors at the age of 19 that I had to stop exercising, stop traveling, stop riding in a car for more than an hour because of the bouncing movement, sleep in very specific positions with certain elevation of my knees, and most likely carrying a biological child to term would be such a catastrophic event for my spine that it could put me in a wheelchair. And so with that kind of diagnosis at that age, to have read a book, eliminated my back pain completely, and then at the time of my relapse, had 2 of my 3 children and exercised till the day they were born, I already knew that that prognosis was not correct. However, and this is where I want to bring tremendous empathy and connection to anyone suffering. Even I, with all that confidence and information at the time, when my back went out when I was 30, I threw all of the mind body stuff out the window, like in a bucket. I was like, see you later. And then the shame of pushing it and having those kids, of disregarding and sleeping wrong and traveling wrong and sporting wrong. And, all the things I had done wrong were, I'm sure, a huge reason why my chronic pain became so severe at the time. And so anyway, when I went, so this led me to actually meeting Dr. Sarno, going into NYU, having an actual appointment with him. And when I did, he explained to me that, yes, the book cure is important. And yes, my belief carried me just so far, but I had never done the real work. This is what I needed to hear from him, that I had never done the real work. And the real work involved, however you go about it, shining a Klieg light on the darkness, the shadow work, as some people call it, of the emotions and experiences we have looked away from, because the brain and the nervous system perceive our repressed emotional world as a greater predator than whatever physical pain is afflicting us. And if indeed, I say that life is a choice between what hurts and what hurts worse, and if indeed the nervous system is such a primitive functioning system that it must choose black or white, it must choose one or the other. It's, fight or flight or rest and repair. It was choosing my back pain as a way to keep me still and safe and not looking at these repressed emotions. And so I got it. I got what he was explaining. And so I said to him, Dr. Sarno, then what do I do? I'm such an A student. I'm so annoying. I was just like, okay, I get it. Let's do it. Explain to me what to do. And I'll do it because I wanted my life. I wanted my life so bad. And I had these 2 babies. And they were only like 1 and 3, so it was time to really step up. And he said, in his estimation, the quickest way to these emotions was journaling. And I was like, I'd always been a natural writer. So I was like, oh, journaling, no worries. Let's go to it. And he told me to make my 3 lists: childhood, daily life, and personality, and to take a bullet off of each of those lists. And at the time, his prescription was 30 minutes in the morning, 30 minutes in the evening. And the reason I have shortened it to 20 minutes a day is nobody will do that.
No, that's a big ask. No. Yeah.
But he knew that the more we really looked there, the more quickly we'd get better. And I, of course, I was going to do 30 and 30. And I probably at the beginning just did like hours of journaling. I was so dedicated. So I know I'm going long on this, but essentially what happened was I started journaling in the way I thought journaling was, which is, I'm a mom, I'm really tired, this is hard, I'm overwhelmed, and using a lot of really societally appropriate, polite words to explain how I felt. And I had what I think at this moment, and always have, as a bit of a spiritual awakening, which is a voice came into my head and it said, this is not the truth that is going to affect your pain. And on a certain level, you're lying. And I said to this voice, I'm not lying. I am overwhelmed. I am tired. And the voice said, I know you're tired. Like, it was a kind voice and it was from my heart and it was really me. And it just said, I know you're tired, honey. There's so much, there's a lot of stuff in there. And you gotta be brave now. You gotta really tell the truth. And in that moment, I penned the first line of journal speak ever written as I teach it, which is, I hate being a mother. And even today, I've told this story countless times. My eyes spring with tears because of the power of that statement. A 19-year-old who had swaddled her stuffed animals with passion and purpose since she was 10 years old, thinking she couldn't have children, then having these kids. I mean, chills all over my body with the impact of that statement, that I had the kids and I hated it. And I didn't know why I hated it, which is why Journal Speak is a process that unfolds once you open the door, because it doesn't stay true. Because first I said I hated being a mother, and then I was like, wait a second. I know I'm onto something, but it's not the everything. And I just opened my heart and my willingness, and I allowed the truth to pour out. And it really went into some deep pain of my childhood, of having such a lonely childhood. I was an only child. My parents had a lot of marital problems and financial problems. And I made a decision very young that I would have my own family. And I knew very deep down, I thought it was going to heal all the wounds of my own childhood. And when you have two difficult toddlers, and it's not healing the pain of your childhood, in fact, it's making you crazy. There was in me, I did not have any idea. This is something people need to understand. I had no idea, a deep psychological wound in there, that I had ruined everything, that I had put all my eggs in the basket, and it was a fail. And my life was going to be a trapped, ruined. I mean, these are journal speak words. Okay. So as soon as I let all that out, and it cascaded into a lot of self-loathing, and it cascaded into incredible heightened anxiety, but I let it. I just made space and I sat with it. And through that experience, and it was a bit of a miraculous experience, and not everyone is going to have this, I woke up the next morning and my back pain was 80% reduced. I called Dr. Sarno and I said, this happened. And he said, you go, girl, keep going. And over the next couple months, I just did journal speak on all of my topics that I didn't even get to everything on the list. My pain was absolutely gone, never to return. My MRI is exactly as terrifying, I guess. I haven't looked at it in many years. And I had another child, exercise till the day she was born, carry my kids' heavy suitcases up and down the stairs, do absolutely everything, hike, bike, run. I'm 49. And I am in the best shape of my life, and my MRI has nothing to do with my pain. So that's my story.
Which is an amazing story. I get chills every time I hear you tell it. And part of the story too, you didn't hate being a mother. You don't hate being a mother. You love being a
Being a
mother.
mother.
And so
Yes.
how did saying you hate being a mother allow you to be the mother that you wanted to be?
The best question I've ever been asked. And here's the answer, because I never hated being a mother. There is a 5-year-old inside all of us. We have an inner child, every single one of us, whether you believe it or not, who is running the show until they are given a voice. And that little girl inside was like, wait a second. These little ones were supposed to come and rescue me. And not only have I not been rescued, but you, conscious grown up Nicole, are all caught up in the day-to-day of this taking care of them. And I have been abandoned, and I'm screaming in here. That was who needed to be heard. And the words that made sense to the conscious me were, I hate being a mother. And I had to say them so I could get past that and what was the real truth. And the truth is, I was a sad, scared, overwhelmed little girl living in a grown-up body. And once that was expressed, I was open to love them so much. And that was the gift. And, now my kids are 19, 17, and 13. And I look at my 19-year-old, who was the one who made me this mother, this horrible failure of a person. And she and I have the best relationship because I didn't parent her through the lens of my own dysfunction. So that is like the secondary incredible benefit of this work, is you can come from a place of honesty and integrity, and that changes the way you interact with everyone.
Yeah. And so I know that everybody who's listening is saying to themselves, like, I want that, like, I want Nicole's experience. And so we're going to talk about that in a second, sort of ways to start to approximate that. As you said, not everybody has that experience, and we'll talk about that as well. Two things I want to highlight too in what you said. So I've been doing a lot of work over the past year. You and I had the conference together at the beginning of pandemic. So it was a year and a half ago. And I've actually learned a lot. Even I have learned a lot about the science of pain since then, and just how much of it is related to fear and that aspect of our brain that turns on the pain signals, and that the pain comes from that part of our brain. I say this to people all the time, but what's by far the number one source of fear in people's lives when they are sick? Do you have a sense of that?
I mean, what I would say is being more sick or not getting better, or what might be the results of their sickness. Like, for me working with other people, it's always, I'm sick and now I'm not going to be able to go on that work trip. And then if I don't go on that work trip, I'm going to lose my job. And then my house is going to be taken and my kids are going to go starving. Like, there's a lot of projection and anxiety. Was that where you were thinking?
That was not, but playing the game, like, what am I thinking, is never a good one from your standpoint. But the medical system itself, I see it.
Oh, right. Well, yeah, I'm a doctor. I could see that being the answer as well.
Yeah. And just, your experience of you're going to be in a wheelchair, you're not going to be able to have kids, like all these things. And I think you're right that practitioners and physicians are well-meaning when they say those things, but I hear story after story after story of people who, visit a practitioner and they say, well, you're like this for the rest of your life. You're old, you're going to be on medication. You'll be lucky not to be in a wheelchair, all of it. And all that does is reinforce this area of our brain that's creating the pain. And then another important point there is that our emotions are such a big source of fear, because we're human beings and emotions are scary. And most of us didn't get great instruction when we were young about what to do with it. And so of course it feels more comfortable to keep it inside than to let it out. And you had put yourself in a place where it could come out, and it could come out forcefully. And that's the other point that I want to highlight, is that you and I and Michelle Grimm, who works with us, and a number of other people who do this work, sort of had these experiences that can only be described as spiritual experiences, or I describe it as just like being tapped to do this work.
Yeah.
And we get this forceful response, right? My story is that after 9 months, I got on a bicycle and I rode my bicycle for an entire hour and just pushed through the pain and pushed through the pain and pushed through the pain until it started to calm down. But most people can't replicate that. But it allowed you to see it, and allowed me to see it, and allowed us to know that this is the kind of work that we had to do, and to give those examples, not as examples of what everybody's going to experience, but about this incredible power of the connection between our mind and body.
Yeah. And I will tell you, I've had a bunch of those. And that's why I have a podcast, and we just hit 2 million downloads. So people are listening to these stories, and I won't go and tell them all now or even one of them, because we have so much more to talk about. But yes, those kind of just insane, hard to believe shifts in my pain and in my symptoms have happened many, many times, proving over and over the absolute power of this work.
And so what I just heard you say, which actually is an important point for everybody, is that once you wrote that sentence and woke up the next morning, that was not the end. It's not that you've never had pain since then. It's probably, and you can speak to this, probably that when you do, you know where it's coming from, you know what it has to do. And I think probably more importantly than anything else, it probably doesn't scare you.
100%. That is the incredibly true statement. So one thing I want to say is there is no cure for human pain. This is not about being pain-free. Pain-free is a real catchphrase in this work. And I like to say I am chronic pain-free, because chronic pain is an epidemic of fear, and there is almost nothing that scares me. Listen, if I cut myself and it's a deep cut and I need stitches, which happened to me twice during the pandemic because I had 2 pretty bad bike accidents. And, I know I'm a bit of a spaz, but I was biking like 20 to 30 miles a day. So within a year and a half, 2 trips to the emergency room isn't that bad. Yep. But no, I really, really injured myself. It didn't scare me. It was like a bummer and it hurt, but I knew that if I took good care of it and I cleaned it and I did what I was told at the hospital, it would heal. That's acute pain. And as would any acute pain, breaking a bone, whatever. And when I get things like headaches or a stiff back, or I can't turn my neck or whatever, I'm a human being. Sometimes we feel things in our hearts and sometimes we feel things in our bodies, and they are literally interchangeable. I could be having a really stressful day and not be able to turn my neck. It's not because I slept on it wrong. It's not because anything is wrong with my neck. And so, because I am never worried about something like that, I give it space to move through me. And here's another thing that people need to understand: it's not going to move through you right away. I've gone through I've had a really difficult year in my personal life. I haven't talked about this much publicly, but I'm going to say it here because it's time to say it, because it's over, is that I got divorced. And in that, it was incredibly painful and stressful. This involves children. This involves, I mean, anyone who's been divorced or known someone who's been divorced, it knows. So I had at the beginning of this whole process, real pain in my scapula. The scapula is right up here, right? The wing. And
Yeah,
I could barely turn my neck. And I knew what it was. It was so clear what it was. But even with journaling and meditation and self-compassion practice, there was so much going on in my life. It just was doing me the kindness of holding a bit of it. My heart was so heavy that I needed it to take a little bit off my chest onto my back. And it did. And because I related to it with that kind of openness and willingness and kindness, it did go, but it did take a week or two, and that's okay. What worries me for people is if you get something like that, you get caught up in the fear, you attach the meaning, you start seeing specialists, they start saying things to you like there's nothing we can do for you, and unless you want to take opioids, and opioids won't even help you, and all the things we hear. Then it becomes chronic, then it spreads to the neck, then all of a sudden you have migraines, neuralgia. There's so many things that I watch happen to people because of the fear. So yes, the answer is, I am not a person who does not experience pain. I'm a person who experiences pain with the open arms of a person who understands what pain really is, which is information, and I allow it to move through me, and I live a life of complete freedom as a result.
Yeah. And you and I had talked about you getting divorced. And again, I'm sorry about that and understand how it opens up new possibilities too. But thank you for being brave enough to talk about that in front of all these people. And I'm always amazed at how open you are in that way and how willing you are to be publicly vulnerable and just talk about your experiences in ways that help people move forward. So
well, thank you, John. I appreciate that. And here's the reason: because I'm not here to do anything other than to be with. I want to be with. I know I do hold myself in esteem. I know I'm an expert in this field, but my expertise has to do with me sitting beside people and knowing that because I'm sitting beside them and because I'm willing to use my story as a teaching tool, they are exponentially helped. And it's my favorite thing.
Yeah. Let's pivot and talk about journal writing as in a way that people can access it. And so many people who are listening are Curable users and probably fans of yours and understand journal speak. And I get a lot of questions about what's the best way to do this? What's the best way to access it? What kind of exercises should people do? And so when people are trying to enter into that type of practice or trying to deepen that type of practice, what suggestions do you have about helping people enter into that space?
Okay, so the first thing I'll say is, if you're completely new to this, do go to my website and look up. I have free resources. I have a tab called How to Journal Speak. I have it all written out. It's also a whole chapter in my book, because there's not going to be a way for me to explain everything about the foundational work right here. But in very brief terms, this is Dr. Sarno's work evolved, but it's making 3 lists because it's good to have an inventory of your life. And the lists are childhood, or you can put just past stressors if childhood feels too limiting, daily life, and personality. And in the realm of personality, it's all the things that keep us stuck because of who we are? Are you a perfectionist? Are you a goodist? Do you feel like you're your own worst critic? Do you feel miserable if everybody doesn't agree with you or like you? You know, are you super, super codependent? Do you feel really attached to other people's feelings in order for you to feel good? You know, these are personality characteristics that tend to, are you super anxious? You know, that tend to affect every part of our lives. So you make these bulleted lists, and the way journal speak works is you take one item from the list each day. I prescribe a 20-minute journaling exercise followed by a 10-minute loving kindness meditation. So the journaling exercise should be akin to what I said mine was, which is you start by being a court reporter. You start by just saying what's going on. So it's, you know, you don't, because people say to me all the time, how do I get to the deep stuff? And you can't push the deep stuff because remember, this is your brain and your nervous system thinking you are so in danger from feeling these feelings that physical pain is the better option. So you're not going to just shake at the shoulders of your brain and your nervous system and get them to give up the goods. So you just have to start with being present, opening your arms. Exactly, John, what you said to me about being vulnerable. Just be vulnerable. It's only you and you there. Nobody else is watching. You start telling the story. So if it's about, you know, your son who's having a hard time, you could say, my son, you know, Jack is struggling in school. He doesn't have a lot of friends. It makes me feel sad. The other day he came home and he was crying. Tell the story. And then as you're telling the story, and this is something you have to be willing to do, you will be invited from your deeper self, from your higher guides, from your heart, whatever you want to call it. There will be something that comes up, and it might look like, I felt exactly how he felt at my age, and it is just too excruciating to watch, right? It could look like that, but something will come up, and then just allow yourself to go with it. I call it like putting a bunny in the snow, and it might go left, and it might go right, and it might go up, and it might go down. It might start at your son. It might be, you might be at the playground in 6th grade. You might be yesterday in the grocery store. I mean, just allow it to flow. And at 20 minutes, when your timer goes off, you press your timer. If you're on a document on a computer, you select all and you delete. If you're writing it longhand, you rip it up into a garbage can that nobody's going to see, maybe a public can, or maybe just at the bottom of the garbage can. This is a language that other people will not understand. I have had to journal speak horrible things about my children, about my life, about myself, about my parents, because it's just the inner child. It's not, doesn't stay true. It's like, I have a client who called it like blowing your nose into a tissue. Throw it away. It's just getting something out. There's nothing, you know, when you have phlegm and you need to get it out, yeah, it's real and it needs to come out, but it was just a product of sickness. It's not anything that you need to honor or cherish. Like, get rid of it. And so I really want people to feel the freedom of this expressive writing in the fact that it gets immediately deleted. There is no reason to hang on to it. And then immediately I prescribe. I mean, people, you know, tend to alter this in ways that make sense for their life, because I know people who work in an office job and they said, I just ran out to my car and I did a 20-minute journal speak on the back of a napkin and I had to go back into my boss. If that's what you need, you do this as you need. People are very concerned with the right and the wrong way to do this, which is, don't worry about that. But in an ideal circumstance, you will sit for 10 minutes at the end of this in some sort of a way that helps regulate your nervous system again. You know, so when I say a loving kindness meditation, that could be singing bowls, that could be monks chanting, that could be affirmations or mantra, that could be a guided meditation that you download off. You know, I know Curable has guided meditations. You know, whatever works for you. And to me, the message that you're sending yourself in this loving kindness meditation is, it's okay that I said those things. It's okay. I'm saving my own life here. So the fact that I had to say, you know, I hate caring for my dying mother, you deserve to say that, because you know what? It's hard for you. And if you can say, I hate caring for my dying mother, I promise you the compassion with which you show up to her bedside next will be greater. Your nervous system will be more regulated and your pain will go away. And so this is does that do a good enough job of explaining it?
Yeah, absolutely. And a couple things to highlight there. So you had mentioned that Curable has a number of meditations that help with re-regulation after the writing the safe place visualization. And so imagining and just laying these out so that people can find them afterwards. The safe place visualization, imagining yourself being in a serene place where you can calm down and let go. Surrender meditation, which allows people to release tension and imagine being, say, in water and floating weightlessly. And the forgiveness meditation, which is what you just said, in terms of like cutting that energetic cord and allowing for the fact that those thoughts and feelings are inside us, and that's okay, because we're human beings and not because we are bad people. And we get confused about that a lot, right? I've talked to people so often who talk about feelings they have and immediately start to attack themselves because they have those feelings or the thoughts that are coming out on paper. And I've heard people say that if you're not embarrassed about what's coming out in the writing, then you're not at deep enough a level when you're doing it. And that's why you suggest just getting rid of it and not coming back to it, not reading it later, not sort of trying to create a narrative out of it, but just letting it flow out and then letting it go away.
And let me speak to one thing, because I do get this question a lot when I say the thing that you just highlighted.
Yeah.
Let's say you come across in your journal speak a real revelation, right? Something comes to you that you just did not know about yourself before, and you want to share that with your therapist or your curable group or a trusted friend. Jot it down. So I'm not saying that this is like all or nothing and get rid of it. There have been times where there was one paragraph in my journal speak that's nothing I'm embarrassed about, that's nothing that I am scared someone else would read, but it's a revelation that maybe came from an embarrassing rant that I don't want anyone to read. And I might copy that paragraph and put it somewhere for me to refer to later. So this is not an all or nothing. It's just a general rule that if you want the freedom that I want you to have when you're doing this, it's best to know that it's written to be just disposed of.
Yeah. And, there's been a lot, as you know, there's been a lot of research on journal writing over the years, starting in the 1970s. And so that body of research is almost 50 years old at this point. And, one of the things that they found in the research is that including both thoughts and feelings is more beneficial than just thoughts or just feelings, which is why you found that like recording what was going on in your life was just a place to start. You had to get to the feelings underneath in order to get that release. The other is that they really do think it's the letting out of secrets that's one of the ingredients that makes it so effective. And so that's why it's so useful to find those things that we haven't said and put them down in a safe way that we can then let go of and move on.
100%. They say you're only as sick as your secrets. And I often quote that.
Yeah. And so that I think, and then one other piece I think that's helpful from the research is that there really isn't a right way or wrong way to do this. And so I think we all want guidelines and prompts and ways to get started. And people can find those through your work on Instagram and your website and program. They can contact us, and we have handouts that we can give out on journal writing. But those are tools, and the work happens within using the tools. They're not ends of themselves. They're ways to do this, ways to let the secrets out, ways to let the feelings out, ways to have these cathartic moments. And there's not a precise pathway to get there. Everybody gets there in slightly different ways, and that's come from their research too, that there's so many different variations of this that we don't have to think like there's a magic formula out there.
Yeah. And I think you brought up a really good point about you have to do it. A lot of people with TMS tend to be over researchers, where they just want to read one more book and they just want to have one more consultation with someone. And I often say it's like going to the gym. And when you go to the gym, they give you that beautiful tour. The person takes you through, this is the weight room, this is where the cardio is, this is where the Zumba classes are. And you can look, you could be like, wow, this is really interesting. If you don't go to the gym and do the things that they're showing you, you will not be changing your physical body or your physical health in that fashion. And so this is really about doing it. And I'm going to tell you guys with my heart, you're not going to want to. And that's okay. You will resist this process. And resistance to the journal writing is part of TMS. Your resistance to your journal writing is the same as having a headache or a backache or a fibro flare, because your nervous system is looking to divert you from doing the journal writing with your own voice saying, I'm too tired, or this isn't going to work for me, or I have too much going on, because the whole point is to keep you from these things. And so you have to say to your resistance, thank you. I hear you. I love you. I honor you, but we're going to go do this now.
Do you ever have resistance?
All the time. I hate doing my work. I hate doing my work. I love the mindset and I love the peace that I feel when I know there's a solution. And then I go to sit down and it's like, we're all just human and it's all just a function of the brain and the nervous system. And so when I find that compassion and almost that maternal voice of, I hear you, I love you, we're doing this now. Yeah.
So before we start to wrap up, a couple of points that I want to discuss in terms of the writing. And so very few people are going to do the writing, go to sleep and wake up 80% better. We talked about that fact that that you and I had these almost mystical experiences, but we know that that's not the rule. And so what happens when people do the writing, get the secrets out, and the pain isn't getting better? What are your thoughts about that? And how do we provide encouragement and hope for people when they're in that situation?
So there's two levels of that. The first I like to talk about is I want you to picture your brain and your nervous system like an abused animal that you just got from the shelter. So you want to love it and it's here and it's under the bed. It's in the closet. It's trembling in the corner. So your ultimate goal, because we always have to start the end in mind, is to be able to have it come and sit in your lap and be your pet. So do you do that by forcing and saying, get over here, come on now, I've been waiting for 3 days? No, you calmly and gently and kindly and patiently and lovingly sit a few feet away with the treat in your hand and say, I'm here, I'm still here. Consistency and kindness and compassion are the code to breaking this pain cycle. So if you're showing up with the kind of intensity and urgency, I'm going to write this out and I'm doing it, your nervous system is going to be that trembling animal that says, this does not look like a person to be trusted. So I'm just going to sit in the corner for days, months, weeks, years, And so it's really about just, honestly, the best posture for this work is to give up. I know that people hate when I say this, but it's such powerful teaching. This is about surrender. This is about acceptance. This is about understanding that transformation begins with the radical acceptance of what is. It's not helped along. It's not aided. Transformation begins with opening your hands and saying, I'm out of good ideas. I know this works. I know this works because Dr. Stracks says it works. I know this works because Curable has millions of people doing it around the world. I know this works because Nicole goes on her podcast every week, and every other week she does an interview with someone who has this miraculous recovery. I understand that it works. I just need to be in my own experience with patience and kindness for myself. And if you go into it with that posture, you will get better. I can't give you a time frame because a time frame feeds that fear and that looking at the watch and that staring at the animal and saying, get yourself over here. It just doesn't work that way. So what I tell people is true surrender is with your own readiness, and you cannot force that either. But if you understand that what I'm saying to be true, even in just a tiny pinprick of your brain, it's coming for you. And John, I get emails every day from people, and the most beautiful emails I ever get are from people who struggled, and it took a while, and they were frustrated, and they were urgent, and they were terrified and panicked. And I got one yesterday that was amazing, and I just actually wrote her back this morning, and she's going to come back on my podcast. She was one of my real-time heals. And so one of the things I do on my podcast is I have people come on whom I've never met, who I know nothing about, who have just told me their symptoms, and they're willing to come on the podcast. And we do a cold therapy session right there on the podcast. We're both totally in it. and it's revelatory. And so she was one of my real-time heals who wrote me back with just this just tremendous joy, and tears of that her life is completely transformed, but she had to stop looking at the clock. And she just had to do the work and let it happen. And so her name is Angela. So for those of you watching, look out for probably probably November or December. She's going to be back with a follow-up of her real-time heal, because she's absolutely free. She's absolutely free. And that's what's waiting for you. But you just have to just be patient and let it happen.
I know that people oftentimes, they'll read stories or hear podcasts and people get better very quickly. And so a lot of people feel like, A, they're doing something wrong because they're not healing quickly enough, or B, they start to feel ashamed that and they're not going to be able to get it, which is why both you and I have tried to feature people who have had different stories. And so I interviewed one of my patients, Jody, probably a year ago, who had foot pain, and she got better like 2% a month over 5 years. Like that was her pathway. And I still hear from her every 6 or 12 months, just talking about the miracle of having
Still
gotten
a
out of a
miracle, even
wheelchair
if it
and
takes
living
5
life.
years.
Yeah, absolutely. And so it's not a competition sport, and everybody's got their own journey and own timeline.
Yeah.
And then the other related question is that periodically people will call me up and say, like, they're doing it, they're in there, their feelings are pouring out, and now they're having panic attacks and they're getting sick and they're vomiting. Any thoughts about sort of dealing with that reaction, which I've heard enough to know is certainly a possibility when people are trying to get to this level when they're doing the journal writing?
First thing I want to say is it's a possibility, but it is not a probability. And so if somebody's looking at this and saying, oh shit, well, I don't want to start vomiting, this does not at all happen to everyone. But I know why Dr. Stracks is bringing it up, because we don't want to ever look past the fact that sometimes this gets worse before it gets better. Sometimes this gets different before it gets better. Often it gets different before it gets better. That's not always worse. So some people can start out with back pain. The back pain is totally alleviated and they're having really heightened anxiety. I hear about the biggest symptom imperative I hear about is anxiety replacing a physical pain. And so now they're saying, okay, well, I used to have back pain. That's totally gone, which is like, let's not just skim past that. That's amazing, because obviously nothing was ever structurally wrong with you, because your anxiety could not ever replace your back pain if something was actually structurally wrong with your back. But now you have increased anxiety. And I say, yes, you've got it on the run. This is excellent news. I know it's uncomfortable, but this is the thing. And this is the thing about any symptom that should be replacing your original symptom. There is no other way out than through. I just need to say this in a way that maybe just brings your nervous system down. I know you don't like it. I know you don't want it. I know it sucks. But unless you choose what you have, you can't get to freedom without walking through whatever it is that befalls you on the way. And that's just the way it is. And I think that people sometimes like to say, well, now this isn't fair, or it feels unjust, or it feels, and I say, I get it. I so get it. It does feel unfair and unjust, but it's the way it is. And, as Byron Katie says, we can argue with reality, but we only lose 100% of the time. And so it's, I get it. And it's unfortunate, but it's the way out. And either you stay where you are or you change. And those are always our options in life. And true readiness brings us to change. When it hurts a little bit more to be where you are than it does the possibility of change, you change. And so I just want people to be gentle with themselves through any way their symptom imperatives shift or move or change, because that you are on your way. You're on your way to a life of freedom. And it's not just freedom from chronic pain. It's freedom from the affliction of your secrets and your coping and the ways you've kept your life small. It's the most beautiful, magical way to live. And it's on its way to you if you just do the work.
Yeah, and I'm going to run one more thing by you, actually, just along those lines of if people are getting worse as they're doing it. I would say that when I fielded those calls over the course of my career, I'm going to argue, I never say 100%, but I cannot remember a time when, as we opened up sort of what people were doing in the writing, they didn't tell me that they were attacking themselves in the writing. So every time somebody's called and said, I'm having panic attacks, I feel so much worse, when we sorted out, they're telling me that they're spending their time writing about what a terrible person they are, how bad they are because they can't get better, how they've done all these terrible things over the course of their lives. And so I have gone to telling people essentially not to do that. And I'm interested in your opinion on that. But I find that if people are opening up their documents or paper and writing down like, I'm such a bad person, I can't believe I did this, I can't believe sort of I did all these things over the course of my life, I have not seen that be a pathway to healing for people. And so in addition to being kind to ourselves on this journey, which is such an important part of healing, do you find that there's a role for not being unkind to ourselves in the journaling?
I think it's a delicate balance.
Mm-hmm.
I think we can't deny any of our thoughts that are trying to push forward or feelings, because that will become something we require to repress. So if you have a tremendous amount of self-loathing, I don't think it is advisable to not look at it at all. But I do think, I agree with your point wholeheartedly, that if you get mired in it, you will get lost in it, and the shame will become the primary place that you live. And so I think it's about allowing the thoughts to rise, allowing them to rise enough that they are seen, that you as a person with some years of experience can look at them and say, I see what I've done. I do see, and I do have regret, or I do have fear, or I do have self-loathing, and acknowledge it. But then here's a really good tool to shift the dialogue. I want you to picture your most beloved soul in your life, whether this be your child or your niece or nephew or your godchild or your pet, okay? Anything that you love, coming to you with tears in their eyes and saying, I'm terrible, I'm this, I'm that, look what I've done. I want you to speak to yourself in that journaling moment the way you would talk to them, because you're just a lovely, sweet, chewy human, that's all you are. And yes, you've done things that you're not proud of, but we all have. And you've done things that you regret, but they were part of the trauma that you inherited. And so being gentle and kind with yourself, and if you need to look at it as somebody else is saying those things, is sometimes a helpful tool, because I don't want us to deny any parts of ourselves, but I also don't want us to get lost there.
Yeah, absolutely. And like I said, just being able to be kind to ourselves and gentle with ourselves, and move forward, understanding that we are human beings and we have symptoms because we're human beings, not because we've done anything wrong, not because we are doing anything wrong, not because we are bad people, but because we're human.
And that's part of the ride. I often want to tell people to not forget that it's the reason we're here, to have big feelings. It's the whole reason to be alive, is to connect and to feel and to get it and to hurt and to cry and to break so we can grow. And so stop not wanting that, because that is literally the point.
Anything else that people should know before we sign off for the evening? Anything else you want to add?
Just that if you need more support and if this piques your interest, I have a lot of stuff out there to help. Do you want me to say where people should find me, or is that
I do want you to say where people can find you, because people should find you.
People should find me. Come find me. So I have a website called thecureforchronicpain.com. I have a YouTube channel with the same title, and I have a podcast with the same title, The Cure for Chronic Pain with Nicole Sachs. The Instagram is at Nicole Sachs LCSW, and I spend a lot of time and energy there and have a lot of great community going on there. I also have a book available on Amazon called The Meaning of Truth. I also have 2 online courses available on my website, Freedom from Chronic Pain and Freedom from an Anxious Life, specific to anxiety. I also have a vibrant community on Facebook. It's a closed group. Nobody sees your posts but the community. And that is Journal Speak with Nicole Sachs on Facebook. And, just if all of those things are too much, just Google my name, Nicole Sachs, it all comes up.
That is a lot of places to find you. People can find me only at my website, www.drstracks.com. And anybody who's interested in working with us can connect with us that way as well. And so we will end there. Thank you so much. Like I said at the beginning, like anytime I can spend an hour with you is just a fantastic use of my time. So I am so grateful for you for being here and talking about this and sharing your wisdom and expertise. Thank you.
Thank you, John. I feel the same.
And thank you also to everybody who's been here and listening. Every time we do this, I'm reminded what an incredible, brave, caring, loving community we are part of, and people who are out there and being vulnerable and doing this work and understanding that there are so many pathways to healing other than medication and surgery. You'll be able to find this recording for people who want to watch again, and all our previous episodes at Curable and My Hope for Healing landing page, which is curablehealth.com/hope for healing. You can also sign up for our office newsletter and get updates about next episodes and things that are going on in our practice. And I'll be back in 4 weeks on Wednesday, November 17th, 5 p.m. Central Time. And I hope everybody can join us then. Until then, please stay safe and healthy, and everybody have a good night.